We're lucky here at Dana-Farber to have a number of clinical trials for patients with ALL. It's a rare disease, but we're really focused on improving treatment for this rare disease, and this is a center where we have the resources to do that. So we have a lot of clinical trials for patients at different ages and different types of ALL. But one trial we're particularly excited about is a trial we have open for adults who are with ALL who are 60 years and older. And this is a group of patients that have historically had a challenging time with traditional chemotherapy. When we give traditional chemotherapy to these patients, they don't respond as well as younger patients, and they have a lot of side effects. And so this is a group that's been in particular need of new approaches. Luckily, scientists around the world, but including here at Dana-Farber, have really given us the tools to come up with better approaches. And the approach we're taking for this group of patients is to decrease the dose of chemotherapy, to decrease the amount of side effects, and add a novel treatment, a new treatment, to sort of enhance the ability of that treatment to work. And this is a trial combining venetoclax, a drug that helps when combined with chemotherapy, helps that chemotherapy work. Combining venetoclax with mini hyper-CVD, which is a dose-reduced chemotherapy. Because venetoclax is such a well-tolerated drug when given with this dose-reduced chemo, we're able to get, what we're seeing is that we're able to get response rates that are higher than with traditional chemotherapy, but with less chemo and less of the side effects. So patients are getting into deep remissions, something called measurable residual disease negative remissions, meaning we can't detect the disease even at low levels. And we're seeing that patients are able to either move on to something called stem cell transplant, which they might not have been eligible before, or for patients who aren't able to bridge to that therapy are able to stay in remission on the chemotherapy for a prolonged period of time. And we've already participated or already conducted a phase 1 study of this regimen, and our early results suggest that it's well tolerated and that the response rates in patients who haven't had prior treatment are really promising. And that promising early results has prompted us to take this trial into what's called the phase 2 setting and be able to treat more patients to learn more about the safety and efficacy of this regimen. This trial is available to patients with newly diagnosed ALL who are 60 years and older with B-cell or T-cell ALL without the Philadelphia chromosome. The patients with Philadelphia chromosome have a different route of treatment because of that particular abnormality, but any adult 60 and older with leukemia without that abnormality would be a potential patient for this trial, and we'd be happy to see anybody in that situation to screen them for eligibility.